Hi guys, my name is Oudi Abouchacra, Oudi like the cartoon in Garfield. I'm a chiropractor, and I want to just explain a little bit about what chiropractors do and what the whole profession is about. So the first thing is we believe that the body has a power to heal itself, right? You get stung by a mosquito, you wake up in the morning and it's pretty much healed and sealed, or at least sealed. And in the process, the process of healing is in motion. We understand that when we have various injuries as well, the body has the capability of healing itself. So that's the first thing that chiropractors recognize. And we call this healing power the innate intelligence of the body. All right. Now, the second thing is we understand that the healing system really comes from the nervous system. So our nervous system is what gives us the ability to heal ourselves. Now, we know that the central nervous system is our brain, our spine, and our nerves. And so when we keep the vertebrae, the bones in the back, we keep them healthy, we keep the central nervous system flowing and communicating to the whole body. So what chiropractors do very simply is we check the spine, okay, through touch. We feel where the bones are not moving well. We challenge the bones and see where it might be sensitive to move them in certain directions. We ask the patient to perform various movements and tests. We may require an x-ray or use an x-ray or MRI that's been done previously. And when we put all those together, we can basically tell the patient where they stand in terms of spinal health. Like, are they at phase 1 in terms of the spine wearing down? Are they at phase 2 where we have disc problems? Are we at phase 3 where there's some calcification, or maybe phase 4 fused? So depending on where they are, we then go ahead and treat the spine. And what we do in the treatment essentially is when we free these bones up, these spinal vertebrae, in essence, we set the central nervous system free. And by setting it free, we set the body's ability to heal itself free. So think of it like this. Think of these bones in the spine as protecting the communication pathway from the brain to the spine to the nerves and to every cell of the body. Okay? Think of it like we free the internet. We have maximum bandwidth, and their communication from the brain can get to the body in every cell, and the communication from the cells reach the brain. And so the body doesn't have communication breakdown. And again, when we free these bones, we free the nervous system, and therefore free your body's ability, you guessed it, to heal itself, because the body has that inborn, innate ability to heal by itself. So what kind of cases do we treat? Well, the most common cases, people come into chiropractic offices primarily because they have back pain. Okay, spinal pain, but let's just start with low back pain. So you got pain in the lower part of the back here, whether it's off to the side or in the center. All right. They can sometimes experience upper back pain or mid back pain. And of course, they can experience neck pain. So these are the common complaints people come in with. Other things that people come in complaining of would be headaches and disc injuries or spinal misalignments, such as a scoliosis where the spine is curved, it's not completely straight. Patients can also complain of arm pain, shoulder, elbow, wrist, even fingers, and as well what we call hip pain, knee pain, and ankle and feet pain, right? So pretty much all the joints of the body. Let me give you just an example of one particular person who I treated. So this gentleman came in complaining of neck pain and dizziness, all right? So we did our examination and we found that he's not able to turn as far as he can, or as far as he wants to one side. So this side's restricted and this side's full. He's got full range to the right and limited range to the left, okay? And maybe with a bend, it's limited here and this range is okay. And maybe up and down, there's one that's not able to go as far as he wants. Now that's in terms of ability to move. But sometimes there's also pain. It's not that it's blocked, but it's that the pain is stopping the patient from going any further, right? So pain or restriction are some of the things that this particular patient experienced. Now, the person was also experiencing dizziness, right? And so what we did is we looked at x-rays. X-rays were fine, and all the ear tests were absolutely okay. The ENT tests were okay. And so what we discovered was that this particular person had a problem with what we call the upper cervical, or the top two vertebrae, all right? This is the second vertebrae right here. and the first vertebrae you can feel from the side. So these two bones weren't moving so well. And so what we did on palpation, we felt that the joints aren't moving well. And so we administered what's called a chiropractic adjustment. Now there's many different ways of adjusting the spine. Okay, you can use your hands, we can use instruments. You've even seen techniques where chiropractors use towels and that kind of thing. There is some equipment we can use. But the main thing is we freed these bones, we unlocked these vertebrae. Some patients after the first treatment, instantly they feel some change. For example, these are the three kinds of things that patients can report. One is the range of motion feels fuller, like it feels equal now. They can go left and right equally. Sometimes the patient will say, it's still limited, but it's less painful, okay? Or the patient just feels, without movement, just a general, reduction of the dizziness or the symptoms that they complain with, such as neck pain, okay? This particular patient had approximately 33% improvement just off the first visit. So instantaneous improvement and change with range and with the way he felt. So what we normally do is we generally see the patient immediately after, within 24 hours or 7 days afterwards, we treat the patient again. And this particular patient, like I said, still came in reporting about 33% improvement. And after about 5 to 6 treatments, the patient was pain-free. So there was no use of medication. There was no need for any other tests such as CT scans or MRIs, and that's just an example of how a patient can respond well to chiropractic care. Now, if somebody comes in with a disc injury, they're told that they have a disc, let's say in the low back. I can think of one particular patient now as I'm speaking to you that had pain in the back that's shooting all the way down the leg, and there's even numbness or tingling in the toes. So what we did with this patient, again, we looked at the MRI, we looked at the x-rays, and what we found was that the patient had what's called a non-surgical disc. They have a disc injury. The surgeons didn't recommend surgery, and sometimes they do recommend it, even though they're not aware that there's another option that exists out there called chiropractic. And so what we did is we started with the patient, we put him on a trial period of treatment, and very quickly, patient started responding. Visit after visit, they feel improvement in range, okay? Starting to feel better, being able to do the things that initially they weren't able to do to the full capacity, such as, walking or sitting extended periods, or even performing some particular moves like picking something up or putting the water into the dispenser, that kind of thing, you see? So their activities of daily living improved. So there's so many cases that I can share with you, but the idea is just to understand that no matter what the case is, what we do as chiropractors is we tap in to your body's ability to heal itself. We tap into your internal or innate pharmacy, if you will, to help you feel better and function better. And so the way we get you well is we free the vertebrae. We unlock these bones by moving them. That frees the nervous system and therefore frees your body's ability to heal itself, which is chiropractic in a nutshell. I'll tell you about the first patient. The first chiropractic patient in 1895 was a partially deaf gentleman. And it was a second vertebrae, probably some first vertebrae involvement as well. But when the chiropractor adjusted the neck, okay, instantly the patient was no longer partially deaf. Deafness is cleared up. And so that's how we were discovered. And now we know that chiropractic helps people who are in pain, but chiropractic is also very effective for people who have no pain at all, but just want to function at their best, or they want to keep it that way. Examples are athletes who get treated before practice, before games, after practice, after games, so they can keep their spine healthy and remove any damage that was done because of an event, or go in strong to an event so they're less likely to have an injury. So that's basically what chiropractic is. We free the nervous system, we keep the joints in the spine flexible, and it's a beautiful alternative to medication. It's a beautiful alternative to surgery. And it really is what one book was entitled, Man's Greatest Gift to Man. Hope you enjoyed that.